Last week we have covered the nasopharynx, then we covered the oropharynx, lateral wall of the oropharynx. Remember, you have actually here we can, well, it is hard to study it here, but right here we have the laryngopharynx or the hypopharynx. Hypopharynx lateral and anteriorly surrounded by the thyroid cartilage. Look at thyroid cartilage and thyrohyoid membrane. And medially it is covered by the arytenoid cartilage and aryepiglottic fold and epiglottic cartilage. And here there is a recess, this is called preform recess. In the preform recess, we have the laryngeal fold. This is also known as the plica nervi laryngae. This laryngeal fold is formed by the superior laryngeal artery, superior laryngeal vein, and the internal branch of the superior laryngeal nerve. So if a foreign subject latches here, and when you try to remove it, then you have to make sure that you do not injure the vessels and the nerve within the laryngeal fold. Okay? Now, let's move down to, can I have that larynx here? Look at, here we have the laryngeal cartilages. We have 3 paired and 3 unpaired laryngeal cartilages. Let's look at the unpaired. Look at this is the thyroid cartilage. Thyroid cartilage is unpaired. This is epiglottic cartilage, unpaired. And down here we have the cricoid cartilage, also unpaired. How about the paired cartilages? We have the, look at this one, arytenoid cartilages, paired. Corniculate cartilages, paired. We have also cuneiform cartilages, right here. Look at this one here. Can you see this one here? These are the cuneiform cartilage, also paired. And we have tridacil cartilages, they are also paired. Actually, we have 4 pairs of small cartilages. These are tridacil cartilages paired. They are found in the lateral thyrohyoid ligament. Okay, now let's go with each of the laryngeal cartilage. The largest one is the thyroid cartilage. Thyroid cartilage consists of 2 quadrangular laminae. Here is the left laminae. This is the right laminae. They fuse in the midline anteriorly and form the thyroid angle posteriorly. So the thyroid angle faces posteriorly. There are 5 ligaments attaching to the thyroid angle from superior to the inferior. These are, look at this one, can you see the, this is the, okay, look at this one, this is the thyroepiglottic ligament. Thyroepiglottic ligament, this one here. And then slightly below the attachment of the thyroepiglottic ligament, we have the attachment of the vestibular ligaments. So the anterior ends of the vestibular ligaments also attach to the thyroid angle, slightly inferior to the attachments of the vestibular ligaments. We have the attachments of the anterior ends of the vocal ligaments. Vocal ligaments. Now, this fusion of the laminae anteriorly during when the boys reaches the what's called puberty, this grows anteriorly, becomes prominent. This is called Adam's apple, or the laryngeal prominence. Laryngeal prominence. Remember, just behind the laryngeal prominence, you have the vocal ligaments. They also, with the formation of the laryngeal prominence, this vocal ligaments, vocal folds also increases in length. This forms the or creates the thicker sound in male. Okay, here we have the superior laryngeal, superior thyroid notch. Down here we have the inferior thyroid notch. And look at here, this is the oblique line. Here is the oblique line. Oblique line has an upper end called the superior thyroid tubercle, has a lower end. Here we have the inferior thyroid tubercle. Inferior thyroid tubercle. Again, oblique line, inferior thyroid tubercle, superior thyroid tubercle. There are muscles attaching to the oblique line, which are the sternothyroid muscle inserts on this line, and thyroid muscle originates from this line. And each thyroid laminae has a superior horn and inferior horn. Inferior horns articulate with the cricoid cartilage. Cricoid cartilage. So here we have cricothyroid joint. Cricothyroid joint is a synovial, movable joint. Okay, so these are what we have with the thyroid cartilage. But look at here, from the superior margin of the thyroid cartilage to the hyoid bone, there is a membrane here. This is called thyrohyoid membrane. Look at this one here. This is the thyrohyoid membrane. This is the thyrohyoid membrane. This thyrohyoid membrane in the midline thickens and forms the median thyrohyoid ligament. Laterally, on the posterior here, it thickens and forms the lateral thyrohyoid ligament. Lateral thyrohyoid ligament. On the thyrohyoid membrane, there is an opening through which internal branch of the superior laryngeal nerve. Look at this one. This is the superior laryngeal artery, and superior laryngeal vein pass through right here in the thyroid membrane, thyrohyoid membrane. Again, this is the superior thyroid artery. Gives a branch. This is the superior laryngeal artery. Superior laryngeal artery. And then you know the course of the internal branch of the superior laryngeal nerve, superior laryngeal artery and vein. They run on the bottom of the preformed recess, forming the plica nervae laryngae, or the laryngeal fold. Right here. Okay, so we have done with the thyroid cartilage. Now let's look at the cricoid cartilage. Look at This is the cricoid cartilage. This is the cricoid cartilage. You can say this is the second largest cartilage of the laryngeal cartilages. Now, this cricoid means ring-like, looks like a ring. This cricoid cartilage has a laminae posteriorly and has an arch anteriorly. On the lateral surface of the cricoid cartilage, there is a facet for articulation with the inferior horns of the thyroid cartilage. And between the superior margin of the cricoid cartilage and inferior margin of the thyroid cartilage, there is a membrane here. This is called cricothyroid membrane. Cricothyroid membrane. This is, or we call this conus elasticus. The fibroelastic membrane here is called conus elasticus. Okay. Now then move to, this is the epiglottis. This is the epiglottis. It's anterior surface, its posterior surface. On the posterior surface, there is the tubercle, and we have openings or little holes. These are created by the internal branch of the superior laryngeal nerve. And this stalk of the epiglottis is called pediolis. This is the pediolis, this one. And again, this is the epiglottis. This is the epiglottis. For that, here is the anterior surface of the epiglottis. Here is the posterior surface of the epiglottis. Here is the tongue. So it is located posterior, superior to the root of the tongue. That's why it's called the epiglottis. Epiglottis. Now, epiglottis is attached to the tongue through one median glossoepiglottic fold and two lateral glossoepiglottic folds. Between the lateral and median glossoepiglottic fold, we have the valleculae. Here is the valleculae. This is the valleculae. This one here is the pharyngoepiglottic fold. Pharyngoepiglottic fold. Look at this one here. Again, this is the corniculate cartilage. Here is the cuneiform cartilage. And this is the corniculate tubercle. Here is the cuneiform tubercle. This is the aryepiglottic fold. Aryepiglottic fold. Here is the interarytenoid notch. Interarytenoid notch. And this is the laryngeal inlet. Laryngeal inlet. So this upper free part of the epiglottis moves or the turns or the moves posteriorly and closes the laryngeal inlet. So when we swallow something, what we swallow, what we drink, does not get into laryngeal cavity because this epiglottis closes the laryngeal inlet. Do you have a question?
These you said they're created by internal branch of
The superior laryngeal nerve. And you have a question?
When someone gets their tongue inside when they're unconscious, does the tongue close the epiglottic opening? Or like? Just
Well, generally the tongue is proper. This epiglottis does not close up while you are unconscious. Okay, so it's not that
Yeah, they're not related.
it's not that elastic, yes, because you have to forcefully, you have to use your muscles. So you have to use your muscles to move this epiglottis over the laryngeal inlet. So you have to be conscious and consciously, intentionally close this laryngeal inlet. But when we are conscious, our, especially genioglossus muscle, does not work. Genioglossus muscles do not work. In that case, our tongue is moved back and closes the oropharynx. So we cannot continue respiration. Okay? Okay, so far we have covered the thyroid cartilage, we have covered the epiglottis, then we have covered the cricoid cartilage, and then we talk about the laryngeal inlet and the structure surrounding it, and then now we're gonna talk about the arytenoid cartilage. And look at, this is the arytenoid cartilage. This is the